Okay, so we're going to get started in just a couple, just a little minute or so. And I am definitely so excited and pleased that the Emeriti Center again is once again connecting with occupational therapy for this experiential learning and intergenerational opportunity. And the students that are presenting are wonderful, and their professor, Ashley Hall, is terrific. They've been doing a wonderful job, and we've been meeting behind the scenes and discussing everything. And thank you for those of you that have provided questions. And also feel free to put the questions in the chat if you would like to. But again, I am going to definitely just thank them all, ask them to introduce themselves, and they're in charge of today's event. So thank you so much for joining us.
Awesome. Thank you, Jeanette. I'm going to go ahead and share our screen right now. Okay, so then just to kind of reintroduce ourselves, we are first and second year occupational therapy students working with the Emeriti Center for the summer, doing a series of these wellness workshops, as well as offering individual consultations, which we'll kind of describe more at the end of the session. And then just to reintroduce myself, I'm Mia, and then we have
Angie,
Cole,
and Cecilia.
All right, and then our topic for today's session is going to be keeping your brain healthy. And then as Jeanette said, please, if you have any questions or comments, feel free to unmute or put it in the chat. And then we'll also have a designated time following the session just to cover any additional questions as well. So our objectives for today, by the end of today's session, you will be able to differentiate types of memory and understand how they may be impacted throughout the lifespan, understand functional cognition and what maintaining healthy cognition looks like, and learn lifestyle factors and tips to help maintain or even improve function, cognition, and memory. Our agenda for today, we will start off with just a broad overview of cognition, and then we'll dig a little deeper into an overview of memory, types of memory, and changes. And then we will wrap up with optimizing brain health and tips for compensating.
So I'm going to begin to discuss cognition and functional cognition, what it is. So cognition is the mental processes involved in gaining knowledge and comprehension. Cognition plays a big role in human development and the ability to learn and use this information. And cognition impacts all of our functions throughout our daily lives and throughout our life course. So it's very important. So there's some different types of cognitive processes. One of the cognitive processes is attention, which is the ability to focus on a task or subject, like I'm paying attention to this presentation right now, I hope. And learning. Learning is the ability to obtain knowledge and information. And we have language, which is communication through words or symbols for words, and that they have meaning, and a lot of times it's culturally informed. Next, we have executive functioning, which is a person's coordinated ability to plan, initiate, organize, set goals, prioritize, and remember, and self-monitor their everyday activities. And lastly, we have memory, which is we will be going more over into detail later throughout the rest of the presentation. And next, we have an overview of functional cognition. So functional cognition is the ability to use and integrate thinking and processing skills to complete our daily activities in a variety of different settings. These daily activities can include self-care skills, household management, like planning a menu, setting a grocery list, medication management, or financial management, and many more. An occupational therapist can use these everyday task performances to help identify potential cognitive impairments and help decide the plan of care. It is important for an occupational therapist to assess functional cognition in order to identify cognitive deficits, to identify areas that can affect a person's ability to safely carry out these everyday tasks. And before we get started into more detail about memory, I thought it would be fun to play a quick memory video and a quick game. And so we're going to play a video on the screen and try to remember which box the ball goes into, either the left box, the middle box, or the right box. And get ready to type your answer into the chat and see how many you can get right. Okay, type those answers into the chat and then we'll reveal the answer in a couple of seconds. I see some already into the chat. Yeah, there's a lot of left in first boxes. I think first boxes is our majority of the answer. Okay, Mia, let's see the answer. Nice job, everyone. The majority of us got it. Good job. We're going to try one more at level 2. This one might be a little bit more challenging than the first, so pay attention. If you want to play along, type your answers into the chat and we'll let you know what the correct answer is in just a few seconds. I see some coming in already. We've got a couple of a third, the right boxes, second. So far, a couple of three, between 3 and 2. That seems to be our answers. Okay, Mia, let's see the answer.
All right. Looks like number 3 it was.
Thanks, yeah. Thanks everyone for participating and putting your answers in the chat. There's just a couple of ways to help with your memory and thought of a fun game before we discuss more about memory. So thank you.
All right, so moving on to memory. So memory is the process of taking in information from the world around us, processing it, storing it, and later recalling that information, sometimes many years later. Memory is fundamental to living a life of continuity. We rely on our memory every day in order to recognize our loved ones, stick to our schedules, sing our favorite songs, or answer questions such as, how has your day been? Many of us have experienced losing our keys or suddenly forgetting what we were going to say during a conversation. In these moments, we experience the frustration associated with memory loss, but luckily, these lapses of memory typically only last momentarily. Some of life's most precious moments are stored as memories, such as the birth of a child, the day of your wedding, or graduating from college. These events are significant, and the ability to remember each special moment is priceless. Maintaining optimum brain health aids in one's ability to remember past experiences, and it is important to note that significant declines in memory function is not an inevitable result of aging. So now we would like to ask you all to consider sharing what is a happy memory that you have experienced this past year. So feel free to type it into the chat, or if you'd like to, you can unmute yourselves and share. Oh, I see a wedding anniversary, graduating. Ooh, remodeling a bathroom. Good one.
Someone's daughter got engaged. I recently also got engaged. I am getting married too, so that'll be a good memory for me.
Yeah, lots of graduations. Fishing
Oh,
trip.
a daughter admitted to USC. Congratulations. We love our USC Trojans. Trojan family.
Oh yeah, being able to travel again, that's a big one. All right, thank you all so much for sharing.
So now we're going to be talking about the different types of memory. I just want to preface that there are several types of memory and different subsets that fall under the types of memory that we'll be discussing today. However, for the purpose of today's session, we're going to be talking about the following 4: short-term, long-term, working, and sensory. So short-term memory allows a person to recall a limited string of information for a short period of time. For example, remembering 4 to 6 words and repeating them back to another person, or remembering a phone number and then jotting it down. Long-term memory stores a wide range of memories and experiences. So as Angie mentioned, graduations, or as you guys were recalling, engagements and commencements. And working memory is similar to short-term memory, but working memory is when a person manipulates the information and uses it to solve a problem. For example, solving a math problem and then remembering the steps to get to the solution. And sensory memory, which is one of my favorites, holds sensory information. So what we see, we taste, smell, feel for very periods of time. And we're able to recall or have a recollection of an experience with that type of memory. So for example, smelling your favorite food and thinking about an experience. I'd like to open up the floor for a question if anyone would like to share via chat or unmute themselves. Do you guys have a sensory memory that you would like to share? For example, for me, whenever I see a little white dog, I think of my childhood dog, Princess, or when I smell oranges, I think of making fresh orange juice with my grandpa.
I like to share.
Go ahead.
Thank you. My name is Rosalva Kane. I'm from USC the School of Social Work. And I like to share my memories when I smell the jasmines. It reminds me of my childhood at Mexico when I was a little girl. Very strong. Thank you.
Thank you for sharing.
I'd like to share something.
Go
Mrs.
ahead.
Lynn, hi. I cannot smell taboo cologne without thinking of my mother. She had dropped it in a drawer that we had that had all of our odds and ends when we were kids. And, you know, it just saturated the wood and it was just there forever. And she's been gone now for, I guess 30 years or more. And, but if someone has it on or at a department store or something, I'll forget it. It's like my mom. I just miss my mom.
That's a very sweet memory. Thank you so much for sharing. I see in the chat we have a question and then a recollection. So one of the questions was, why are traumatic memories stronger than positive ones? Would any of my colleagues like to answer that question?
I'm not sure off the top of my head. Dr. Hall, do you maybe have an answer to that question?
Yeah, I think it's a very complex question and very layered, and thanks for asking it. I think trauma impacts our brains and our bodies in a variety of different ways, right? Some people repress those traumas and it can come back to them later, right? The way that PTSD presents itself. I think, yeah, maybe we can do a little bit of pulling some more information on that end. And if you'd like, you can send your email in a private message to one of our team members, and we can get back to you on that as well for more of an ongoing conversation.
So Samantha notes wet tan bark, reminding them about their childhood playgrounds, and Jeanette, the smell of roses. Thank you all for sharing. I really love hearing about your sensory experiences and memories. So now we're going to be covering changes in memory. So forgetfulness can be a normal part of aging. As people get older, changes occur in all parts of the body, including the brain. As a result, some people may not notice that it takes longer to learn new things. They don't remember information as well as they did before, or they lose things like their glasses. So again, changes in memory are a natural part of aging. And it's important to note that not everyone will experience declines in memories, as it varies from person to person, because everyone's different. I think one of the biggest things to note is that learning slows down as you age. So older adults typically need more time to learn new information. So it's not as if you just forget something easily. It's just you need to process things a little longer, take more time. Next slide, please. So I really want to emphasize this slide. If you are experiencing serious lapses in memory, hallucinations, or changes in behavior, please consult a medical professional for a diagnosis. It's important to set up routine checkups with your primary care physician to ensure that you are keeping in touch with your health and your body. And early diagnoses can lead to early intervention. So a diagnosis is not a death sentence, but a way for you to remind yourself, okay, I need to stay on top of this in order to reach my highest potential well-being.
Okay, so now we're going to start discussing how to optimize our brain health. So now that we've provided an overview of some of the processes involved in brain health, we'll be sharing several healthy habits that may help maintain or even improve your brain health. So starting with diet and exercise, the MIND diet is a combination of the Mediterranean diet and the DASH diet. Both diets are backed by scientific research and have been linked to enhancing brain health. The MIND diet emphasizes the consumption of 10 specific foods and the limitation of 5 specific foods in order to decrease oxidative stress and inflammation, which are linked to cognitive decline. So the foods that they recommend eating include oily fish, nuts, green leafy vegetables, berries, olive oil, whole grains, beans, and wine. The food they recommend to avoid include butter, cheese, red meat, fried foods, and sweets. Incorporating these foods into your regular diet may reduce the risk of developing neurodegenerative diseases such as Alzheimer's. The best way to absorb the beneficial nutrients of these foods is through direct consumption rather than supplement pills. So we will provide a link to a visual aid for this diet in the chat in case you'd like to print a copy and refer back to it later. In regards to brain health, regular exercise may provide the following benefits: improved memory, lengthened attention span, better decision-making skills, improved multitasking and planning. So remember, good heart health equals good brain health. It's currently recommended that adults age 65 and older need at least 150 minutes a week of moderate intensity activity and 2 days a week of activities that strengthen muscles. So if the information presented in the slide is of interest to you, we do have an in-person workshop coming up that explores the importance of incorporating a healthy diet and exercise into our daily lives.
So now we're going to be discussing sleep. So sleep is an essential part of keeping your brain healthy. According to research, sleep deprivation affects 40 to 70% of older adults, putting them at risk for cardiovascular issues, high blood pressure, and increased fall risk. Our brain needs sleep to properly function, as it is the time for our bodies to relax and recharge. With inadequate sleep, one can experience lapses of memory and feel cloudy or forgetful throughout the day. In our next session, which is going to be in 2 weeks from now, we will be discussing sleep hygiene in more detail. So this will be a quick overview of what you can do to improve your sleep. And furthermore, with your cognitive function. To get a good night's rest, we suggest trying to get 7 to 8 hours of sleep, avoiding stimulants like caffeine and nicotine before bedtime, establishing good sleep routines and before going to bed, and practicing relaxation techniques like meditation or mindful breathing. So participating in social groups and community activities can improve one's mood and can aid in reducing health risks. So socializing and staying connected is extremely important. Socializing can provide a number of benefits to your physical and mental health. Research suggests that connecting with friends and socializing may also boost your brain health and lower your risk of diseases like Alzheimer's and dementia. Being socially engaged allows you to continue to learn more about yourself and about others, helping with memory and retention. Additionally, socializing is noted to decrease feelings of anxiety and depression. When given the appropriate social support, older adults are highly likely to experience positive well-being and an agile mind. With today's technology, there are a plethora of ways to stay connected virtually and in person, like we're doing right now. For example, you can volunteer in your community. You can get more into work, say hello to neighbors while on a walk, and connect with family and friends via Zoom or in person. You can also participate in neighborhood or community groups.
Real quick, Nicole, I think there's a question in the chat about good sleep hygiene. Going back to the sleep slide.
Okay, so what is good sleep hygiene? So sleep hygiene refers to the routines that you have throughout the daytime and before going to bed that leads to a good night's rest. So as I mentioned, like if you smoke, try to not smoke before bedtime. That way you can get a good night's rest.
And we'll also be having a presentation on sleep, I think Nicole mentioned as well. Okay. And then now in terms of learning a new skill, so you may have heard the phrase use it or lose it. So that applies especially to the brain and with learning new things. So I want to mention a concept called neuroplasticity. So this is the ability of the brain to change and adapt and form new connections in response to new experiences and repetition. So that definitely comes into play when learning a new skill. Because as you learn a new skill, of course, you're having new experiences and you're repeating certain tasks or certain things in order to learn. So that's where the neuroplasticity and the new connections come in. So when picking a new skill to learn, you want to make sure you pick something that is challenging. So that way you are actually learning something new and giving yourself a bit of a challenge, but not overly frustrating. So that way you are still enjoying it and sticking with it. And then kind of the opposite of this, there's been studies that have shown that boredom or a lack of new experiences or skills is correlated with a less responsive brain and even correlated with higher rates of heart disease. So there's actual kind of both mental and physical impacts that boredom or lack thereof can have. Okay, and then I also want to talk about a term called positive aging. So this is maintaining a positive outlook on aging and viewing it as a normal and a healthy part of life. So this is kind of the opposite of what ageism might kind of associate with. And so studies have shown that having a positive aging mindset can maintain and improve memory and cognition in adults. So that just that positive outlook in itself can have pretty big impacts on your memory and cognition. Okay, and then naturally, everyone at every age and every situation, sometimes our memory is not perfect. So these are some strategies that we can all use to kind of support that or compensate for that. So there's mnemonic strategies or associations. So I use this a lot when studying, or for example, if maybe you're going to the grocery store and you need a couple items in order to remember them, you might kind of look at the letters of the items you need. So for example, if you need bread, eggs, apples, and rice, kind of taking the first letter of each of those, you get bear. So you might say you're going on a bear run or whatever, just to kind of help you associate that with something fun. You can also utilize Post-it notes. So having notes hung up around your home, just to kind of remind you to do something, maybe part of your routine, part of your medication management strategies. Along with that, having reminders or timers on your phone, particularly with, for example, like medication. If you have to take a certain medication at a certain time every day, it might be really helpful to have an alarm on your phone that rings at the same time every day, just to kind of cue you into that. And then also there's a big importance with specific routines and habits. So on one hand, having that specific routine that you follow every day makes you a lot less likely to forget a part of that routine. So if you have a very specific night routine, for example, you probably won't forget to brush your teeth too often if it's a routine that you follow every night. But there's also other benefits to routines. So it can also be a protective measure as well. Routines might help you be more likely to engage in healthy habits consistently. And it's also kind of less stressful to have a routine and to kind of know what your day might look like. So lots of benefits there with routines. Okay, and then that was about it in terms of our content. So thank you so much for attending and participating. And then we just wanted to kind of summarize that the aging process is heavily influenced by our lifestyle choices. So there's many ways that you can kind of control that or impact that. So that's it for our content. But if you can, please stick around right now. We have some reminders and time for questions right now.
I think before we get into that, Mia, there was another question in the chat.
Oh, okay.
Question.
I'd like to ask a question.
Yes.
I'd like to know more about what you would say about recall. I'm having trouble with my recall.
Okay, yeah. Do you have like an example of maybe what you've had trouble with? Or if
Yes, I'm in a conversation with someone and I can't remember the next word that I'm going to say, and I have to puzzle over it. Sometimes it'll come back to me and sometimes it does not.
Yeah, I think part of that might be normal. Part of that you might want to maybe use some notes. So if you're going into a conversation and you want to maybe jot down some key things that you want to talk about, things like that. This is also something, if you want to sign up for a consultation with us, we can kind of work a little bit more in depth and talk about that more in depth in a one-on-one consultation.
Thank you.
Of course.
I think too, there was a question in the chat about alcohol. I just wanted to add sort of a little bit of information. I think alcohol is one of those tricky subjects where research might show that there is some benefit to brain health, but at the same time, I know quite a few of the geriatricians that I work with, anytime someone is struggling with memory or cognitive changes, usually one of the first go-tos that they'll recommend is cut back on the alcohol use to see if it improves someone's cognitive ability. So I would say if you have questions about alcohol use, I would definitely refer you back to your provider who's going to know you and your circumstances a little bit better to see, is this a good amount to be consuming? How much is too much, etc. Because I think there is a notable discrepancy in the literature related to alcohol and its impact on cognition and what is the right amount. So, and then I see another question in the chat about medication. If anyone wants to jump in.
Yeah, so to answer your question as far as medication to improve memory, we would say that there are a lot of medications and supplements out there. Some of them are legitimate and supported by clinical trial, but not all of it is. So we would recommend exercising plenty of caution, and we encourage you to first speak with your provider and or a pharmacist before trying any specific medications. Hopefully that helps.
Yeah, I think another thing to keep in mind too is I know we're going to have another Emeriti panel later on in the summer. I think we're looking at maybe early August, where we'll have a pharmacist as well. I think I'll be joining, and then a physician assistant colleague of mine too. So I think that would be a great question to run by our pharmacy colleague. They have a lot of expertise with medications. Medications, especially when it comes to cognition, I think it is such a slippery slope. I think it's very prone to lots of claims and, to be perfectly honest, scams. So I would exercise a healthy dose of caution around any sort of thing that's proclaiming itself to be a miracle drug with regards to cognition or memory, anything like that. Definitely run it by your doctor and or your pharmacist before you start taking anything, because certainly we don't want people to fall victim to financial scams, but also we wouldn't want you to be taking anything that could make it worse, right? Or could have unintended adverse consequences as well.
Thank you, Dr. Hall, for answering that question. So as a reminder that we've discussed that we are providing one-on-one student consultations this summer. And if you are interested, to please fill out the link that will be sent in the chat. And if you do need ongoing OT services with an occupational therapist to help with more specific concerns, we can also help connect you to an occupational therapist for ongoing care and supports. We are happy to navigate that for you all. I think Angie just put the link in the chat as well. And as we're wrapping up our last session, I wanted to go over what our next upcoming sessions are. On June 30th, we have sleep hygiene, where we will go more in depth about this concept. And July 14th, we have our in-person session covering staying active and clean eating. And so start planning if you plan on being in person and RSVP so we can get our small groups ahead of time. And our last session will be July 28th, covering home safety. And like I said, we will also be doing individual OT consultations, student consultations, excuse me. So please sign up for those if that is something of interest to you. And if you have any questions or just want to chat or have some comments, we are going to be hanging back for a few minutes. Otherwise, thank you so much for attending. And this is our contact information. If you have any other questions, feel free to email us. And thank you.
Well, thank you very much. That's really informative. I love the idea that no matter how old we get, the plasticity of the brain, you can always expand it and learn more, no matter how old you are. And the other thing that's kind of surprising to me that I've learned just recently, and you also talked about, is one of the most important things to do for your brain is just to get exercise. Just exercise. I mean, we're thinking, and that's good for your heart, that's good for everything. So I think that's really good advice. And I'm looking forward to the in-person. We haven't had very many in-person workshops. And so this one will be sort of a hybrid on July 14th, but we will be, our students will be talking about healthy eating, clean eating. We'll have some snacks there. It's at 1 o'clock, so most people probably will have already had lunch. But so it's the movement part as well as the nutrition part. And based upon the interest of those that come to our events, you can always give us feedback and say, gee, can you bring a dietitian in, or can you, those kinds of things. And we're happy to do that as well. But again, I wanted to thank Professor Hall and Mia, Nicole, Angie, and Cecilia today. I think you did a wonderful job. Thank you for that lovely PowerPoint. And as a reminder, you are going to send us the PowerPoint and also the video. So we will have it up on the website. So any of your friends or family, if you've missed it or you want to watch it again, it will be there for you.
Thank you very much.
Thanks, everyone.
Okay, thank you, everybody.
Thank you too.
We'll hang back if there are any questions, but have a great rest of your afternoon. Take care.
I have a question.
Go ahead.
Oh, okay. So, yeah, I don't think I originally signed up for the July 14th thing because I, was like in person. And then I was down at USC the other day for the Emeriti luncheon. I mean, the retired luncheon, and had the best time. And it's awesome being on campus again after like 3 years. And, I got to visit the dental school and everything. So I'm in. So I just need to know how to sign up for it.
Yes, we're so glad you're in. I think Angie has the link.
Yes.
Okay.
I'll send the link right now.
Yes, so it'll be
Thank
in the
you.
chat.
Thank you.
Of course, we're excited that you will be attending in person with us.
Any other questions? Otherwise, we can go ahead and close out the session. And Mia, if you want to, can probably stop recording at this point too.